Dr. Aaron Dennison, who is a neurosurgeon with Vidant Health, and we're going to talk about back pain. And one of my favorite subjects, not really, but I'm a golfer. I was just talking to Dr. Dennison about my struggles with back pain. Good morning, sir. How are you?
I'm great.
How
are you?
It's great to see you. All right, let's talk about back pain this morning. It's a huge impact on people's lives in terms of their lifestyle and what they can do and can't do and how they feel and those kind of things. So what advice do you have for us?
The biggest thing is to stay active. Especially during COVID, a lot of us, we stayed in, no longer went to the gym, never went out and did physical activities outside because we were kind of locked in. But now that things are kind of slowing down a little bit, the biggest thing I recommend doing is going outside and being active, doing even small things, low impact, walking, stretching, just being outside. It will make a big difference.
I was just telling you, I'm a golfer, so a lot of us at this age, and we've been playing, and I've been playing golf for 40 years. So you get to, or probably more like 50 years. I hate to say that, probably true. Golf's pretty tough on the back.
Yes, it is.
And so I'm like everybody else. I struggle from back pain. At what point do you seek help? At what can you give us a feel for? Okay, now you're at a point where you definitely need to seek medical attention.
So just some general red flags at any point, when you're dealing with back pain. If you develop, neurological signs, so you're getting tingling in the arm or weakness in the arms or the legs, or, you're having accidents, with the bathroom and you don't know it, for example, or any kind of, bad trauma like a car accident or a fall, anything like that, you should definitely seek medical advice quickly. But for just generalized back pain, when you treat it yourself, stretches, you take ibuprofen, Tylenol, do some conservative things. If that's not getting better within 4 to 6 weeks, I would definitely talk to your family physician, and then you'll continue conservative treatment at that point. And if it's not getting better, then they'll refer you to a specialist.
So most of us assume that we have, we've got back pain, you've got, muscle issues or spine issues or something like that. But, I mean, a lot of times back pain can be a symptom of something else, right? I know I have a friend, for instance, that was having back pain, went to the doctor, found out he had cancer.
Right.
Yeah.
Yeah, but no, it definitely can. The whole body's related. So, kidney stones, for example, or people having problems with their gallbladder, all that can go, referred to the back. That's why if you're not getting better, doing conservative things, or you have any of those red flags, you should definitely seek medical.
So what lifestyle changes can we make to try to help with our back pain? And don't say stop playing golf.
You should probably play more golf. Losing weight, staying active, it's really important. Posture. One of the biggest problems that we have nowadays with computers and cell phones, we are always scrouched over, with horrible posture. By doing that, your muscles, they weaken and they want to fall forward because they don't have to do any work. So just keeping your shoulders upright and your head up can make a great deal.
So posture can be a big part.
Huge.
Yeah.
Staying, limber and stretching, also super easy to do, and you have so much less back pain, especially when you golf.
Yeah.
Golf is a lot.
I've learned stretching's a big part of that.
It's a huge part of it.
Yeah.
Also losing weight. Just losing a little bit of weight can have a tremendous impact on less force on your body. Eating healthy, less processed foods, fruits and vegetables, that kind of thing. Not smoking. Smoking contributes to significant chronic pain.
Yeah. Dr. Aaron Dennison, neurosurgeon with Vidant Health. Let's talk about treatments. And now you're a surgeon, but there are other treatments other than surgery.
Yes, sir.
So where do we go normally? What's the normal process of dealing with someone who's got chronic back pain?
So normally, with the help of family physicians, we do conservative things. Things like Tylenol, non-steroidal anti-inflammatory drugs, if we're going to use medicines, because they hit pain receptors. Physical therapy, chiropractic, different things where, we know that it helps with pain. That isn't some type of surgical procedure, because 80% of the time people get better without ever needing somebody like me. Probably even higher than that. So there's all kinds of other alternative forms of treatments like acupuncture and phototherapy.
So acupuncture, really? No kidding.
Yep.
Works, huh? Mm-hmm. No kidding.
Yep.
That's
All that
interesting.
stuff is really just to get muscles to relax.
Right, right. Okay. All right, let's see. What are some of the tests that you use to determine kind of where somebody is when they've got back pain?
So the biggest thing is seeing somebody and talking to them. Just listening to what, how somebody developed the back pain, what it feels like, where it's at, what kind of associated symptoms. Most of the time tells you what's going on. And if you do conservative things and they're not getting better or they have any of the red flags, then we do other different tests such as x-rays or MRIs. But most of the time you can make the diagnosis with just talking to somebody and physically examining them.
How about rehab? When is rehabilitation incorporated into the plan?
So physical therapy and rehabilitation, that's the whole, like the main thing that we do to help people through this once we get their pain controlled. So we incorporate physical therapy and rehab right away.
So, again, we talk about how lucky we are to live in eastern North Carolina where we have Vidant Health. If someone is having back pain, what resources are available to people here in eastern North Carolina to try to help them with their back pain?
So we have a very strong PM&R program here. In our office, we have.
What does that mean, PM?
It's physical medicine rehabilitation.
Okay.
So we have partnered with them to really focus on spine health. At Vidant Neurosurgery, we have inpatient PM&R. We can do injections, alternative forms of treatment besides just surgery. We also have physical therapy, a very strong physical therapy program. And soon, hopefully, the Wellness Center will be open, and that'll be another avenue.
Great. So what's the main takeaway this morning for anybody experiencing back pain? What's your main message to them?
So my main message is to stay active, live a healthy lifestyle, maintain your posture, and call us if you need us.
But the good news I heard you say is that 80% of the time, people with chronic back pain, there are other avenues other than surgery.
Yes, sir.
Yeah,
Yep.
yeah.
So I'm the
I'm
end
sure
of
you
the
have.
list.
I'm sure you have enough business. But
Yes, sir.
yeah. Well, listen. Thanks for being here.
Thank you very much.
Good to
for your
see you.
time.
So nice to get some of this information out there, everybody. Dr. Aaron Dennison, who's a neurosurgeon with Vidant Health here in Green.